Advisory for performing rapid antigen diagnostic assay for COVID-19. The ICMR has recommended rapid antigen assay kit for diagnosis for COVID-19. This is a point-of-care rapid chromatographic immunoassay for qualitative detection of specific antigens to SARS-CoV-2. The test has moderate sensitivity but very high specificity. This can be used to rule in disease. The assay approved by ICMR is known as Standard Q COVID-19 AG kit. Key notes regarding rapid antigen diagnostic assay. Nasopharyngeal secretions. The biological sample to be taken for antigen-based screening. Only a nasopharyngeal swab should be taken for rapid antigen-based test using Standard Q AG kit. Each test kit comes with an inbuilt COVID antigen test device, viral extraction tube with viral lysis buffer and sterile swab for sample collection. The swab should be immersed and squeezed in the viral extraction buffer, provided with the kit. This buffer inactivates the virus, thereby reducing biosafety and biosecurity requirements. The test does not work if the sample is collected in the usual viral transport media, routinely used for collection of oropharyngeal or nasopharyngeal swabs. The usual viral transport media or modified viral transport media should not be used for sample collection. Once the sample goes into the extraction buffer, it should be mixed properly and the buffer tube cap needs to be replaced with a nozzle provided with the kit, and 2 to 3 drops of the sample with buffer are to be put into the well of the test strip. The test can be interpreted as positive or negative after 15 minutes of putting the sample into the well by appearance of test and control lines, which can be read with a naked eye, requiring no specialized equipment. Maximum duration for interpreting a positive or negative test is 30 minutes. The results should be interpreted by a senior lab technician or microbiologist or medical doctor. The DSO shall constitute or utilize the sample collection teams already formed based on previous advisories issued related to testing. Walk-in sample kiosks or mobile medical collection units could be used for sample collection. A testing facility, clean space or clean room, may be set up in places where samples are collected. The samples collected should be collected and tested within 1 hour, and time should not be wasted in sending the samples to the laboratory far away. Settings for application of rapid antigen assay tests. Airport for testing expatriates. Sentinel surveillance. Testing in cluster containment zones. Airport. All symptomatic people arriving at airport need to be isolated to COVID hospital of CFLTC and to be offered RT-PCR. All other people eligible as per the government order need to be tested. Antigen-based test may be used for testing expatriates. Sample requisition form for the same is attached as Annex 1 and 2. Annex 1 alone can be used if real-time request through ICMR portal can happen. Sentinel surveillance. Antigen-based tests could be used for sentinel surveillance. Groups for sentinel surveillance as per advisory issued on sentinel surveillance on 14th May are as follows. The classifications are as follows. The Group 1 include patients in general population with acute respiratory infection. The Group 2 include healthcare workers in non-COVID settings like hospitals, doctors, nurses, paramedics etc. General practitioners, ambulance drivers, others. Persons with high social exposure included in Group 3, such as food delivery persons, community volunteers, provisions shop vendors, ration shop, wholesale fruits or vegetable vendors, police personnel, media personnel and health staff at fields such as JHI, JPHN etc. Group 4 include natives of Kerala who came in close contact with truck drivers arriving from outside state. Group 5 include guest workers. Group 6 include epidemiological sample. Group 7 include samples from expatriates or people with travel history outside state in last 14 days. The subcategories in Group 7 include persons with travel history from red zone districts outside Kerala, and persons with travel history outside Kerala not belonging to above two subcategories. Testing in cluster containment zone. Antigen-based tests could be used for augmented testing in cluster containment. Rapid antigen test for COVID-19 using standard Q COVID-19 AG kit. Cluster Category 1 include healthcare workers in cluster containment zone like hospitals, doctors, nurses, paramedics etc. in the cluster containment area. General practitioners in local clinics. Health staff at field, JHI, JPHN, etc. Asha, Anganwadi workers, ambulance drivers and others. Cluster Category 2 include persons with high social exposure in the cluster containment zone like LSG members, LSG volunteers, food delivery persons, ration shop or provisions or fruits or vegetables vendors or shop owners, police personnel, media personnel, auto or taxi or bus drivers, persons in fuel pumps or stations, workers employed in cleaning public places, bank and other office staff and others. General population is classified under the cluster category 3, like pregnant women, postnatal women, elderly, greater than 60 years, children less than 10 years, persons with comorbidities and others. Guest workers are included in the category 4. The epidemiological samples are classified under the cluster category 5. Epidemiological sample means people in the neighborhood of confirmed cases but not having any contact with the confirmed cases of travel history. Sampling method for cluster category 3, general population. Workers or divisions to be randomly selected. Various random sampling methods like calculator method, simple random generator applications etc. may be used for this purpose. The DSO shall execute this process. Medical officers in charge and supervisors of respective institutions shall provide the updated information to the DSO. Once the ward are selected, a sufficiently large map of each ward should be selected and placed on the table. A pen or pencil should be placed on the map and rotated. The closest road or street on which the fine point of pen or pencil stops rotating should be randomly selected using the method described earlier before starting the survey. 5 such roads or streets should be randomly selected using the method described earlier before starting the survey. The sampling collection can start from either end of the road or street including both sides to select 5 houses. Once 5 hours are selected and sampled, the sample collection team can move to the other selected road or streets. A maximum of 2 members in the house can be sampled according to the priority mentioned below. Pregnant women, postnatal women, elderly greater than 60 years, children less than 10 years, persons with comorbidities, and others. Cluster Category 4 Guest Workers. A sample of the guest workers in each panchayat and municipality should be tested. The DSO shall list all the guest worker camps in LSG divisions. Medical officers in charge and supervisors of respective institutions shall provide the updated information to the DSO. Cluster Category 4 Guest Workers. From the list of camps in each LSGs, camps should be randomly selected from the list using simple random sampling methods described earlier. The sample collection team shall visit the camps and make a list of all the workers present at the time and choose 5 workers using simple random methods and collect the biological samples and test. Cluster Category 5. Epidemiological samples. People in the neighborhood of confirmed cases with no history but not having any history of contact with the confirmed case or travel history outside the state or country in the last 14 days are eligible to be selected. 50 houses around the residence of confirmed cases without history should be selected for the purpose. All individuals in the household may be selected. The DSO may take additional samples or modify the area of collection based on the epidemiological situation of the area. The medical officer in charge of the area shall identify the testing facilities or laboratories or institutions and persons in charge for this purpose in the cluster containment zone so as to provide the test as a point of care test. SRF for the same is attached as Annexure 1 and 4. Annexure alone can be used if real-time request through ICMR portal can happen. Interpretation of the test results. All positive samples are to be treated as confirmed cases and managed as per the existing guidelines. No need to reconfirm the positive results with any tests. If the sample is negative in a symptomatic person, RT-PCR should be performed on a fresh sample from the patient. All COVID suspects to complete their quarantine period even if the test result is negative. Further information. For further information, follow the links below. Recording and reporting. The DSO shall register with ICMR to obtain the login credentials for data entry through the given email ID. All test results, both positive and negative, are also to be entered in ICMR portal with the login ID and password issued by ICMR for the purpose. The DSO should also register in the Kerala government online portal for real-time reporting. All results should be entered in the following link. Daily summary, 12 noon of previous day, of total tests should be entered at 12 noon every day at given mail ID under daily summary. Thank you for patient listening.